Welcome to This Week in Health IT. It's Tuesday News Day, where we take a look at the news which will impact health IT. Today we're going to take a look at a lot of stories. Let's see. We're going to take a look at enterprise software, what's going on with enterprise software. We'll take a look at Cerner AWS, their partnership and how it's paying dividends for researchers. We're going to dig into the financials a little bit. There's way too many stories on the financials and what's going on to ignore it. And then finally, we are going to take a look at COVID-19 proof IT projects, 13 health system execs on tech moving forward and what projects they're going to focus in on. So those are just some of the stories. My name is Bill Russell, healthcare CIO, coach, and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that is how we've been able to do as many shows as we have on a daily basis. Special thanks to Sirius for supporting the show's efforts during the crisis. I would like everyone who's listening to this show to stop right now and send me an email. That is, of course, unless you're driving or something to that effect. But if you're not, flip over to your email client and send an email to bill@thisweekinhealthit.com. We've done 40 plus COVID series podcasts, one every day for the last 7 weeks. And one of the things I want to hear from you is, what is the biggest challenge you or your health system is facing right now, today, May the 5th? What's going on? And if you want to go a little further than that, it would be great if you could just, what is the one question we can try to field on the show next week or to try to address over the next couple of weeks? That's it. Just 2 questions. What's the biggest challenge? And what's one thing we could do or thing we can address, topic we could address that would really help you out? That's it. I'm going to share some of these starting next Tuesday, and I would love your feedback and your input. So again, stop right now. Just stop. Go over to your email client, bill@thisweekinhealthit.com. Send me an email. All right, it's Tuesday News Day. Let's get to the news. Why enterprise software will be forever changed. Why will enterprise software be forever changed? On an earnings call this week for ServiceNow, CEO Bill McDermott said, "Around the world, we see that customers who are farthest along in their digital transformation are better equipped to manage this crisis. Companies lagging behind are realizing that they now have a burning platform. Accelerating digital transformation has become a business imperative." He pointed out that during the next 3 years, about $7 trillion will be spent on digital transformation. And yes, this process is likely to accelerate. Okay, then, what are other people in the industry saying about this? Because that could be a little self-serving if you think about the ServiceNow CEO saying, hey, our stuff's in high demand. No kidding. Soma Sundaram, the CTO for Infor. Sorry, I'm still working on names. He has this to say: as the demand for automation continues to grow, software architecture must adapt to support the vast amounts of data needed to power automated work streams. In particular, there will be a large focus on leveraging cloud technology to enable AI in automated processes. I think that is really true. I think we're going to see automation come to the fore. I think we're going to see the combination. It's not just digital. It's not just engaging the consumer, but it's creating these workflows that are automated. And you have to bring in tons of data, and you have to start to eliminate work and to make it easier for the people who are in that work stream. That information comes to them, that's packaged up, that they can review, that they can move it on. So good thoughts from Infor. Aman Saeed, CEO of BMC, both the technology buying centers and gravity in companies will shift to allow for technology buying across the company. If that doesn't scare you, I don't know what's going to scare you. This is one of the things we have been trying to rein in for years, and that is departments going out and buying things. But I think what we're getting to is a point where people are saying, look, define the architecture, define the framework, and we'll go out and find the best solution for what we're doing. And when you define that architecture, you have to define the workflow, you have to define the data elements, you have to define the things that it brings in. And you can't just throw that out when they find a good solution. That becomes What you are designing is the enterprise architecture, and then they can plug things in. And as long as they play well within that enterprise architecture, the data should flow, the automation should be allowed across multiple systems, across multiple elements. So again, that's what BMC is saying, that purchasing of technology decisions is going to go out into the field. Eric Clark, CDO, Chief Digital Officer for NTT Data, says clients need to reduce dependency on human interaction, so they're looking at solutions that offer contactless operations, self-help, self-heal tools, and automated workflow. I think that's gonna hit healthcare as well. I think one of the things you're seeing through this pandemic is people are getting used to interacting with machines as mediaries for physicians and for office staff and those kind of things. Look, there's nothing really special about the office staff within the physician practice. If it can be automated, if the experience can be improved, that's what the consumer wants. Now, I understand that they add different value to the practicing physician, and that's a whole nother conversation to have. But people are going to be looking for tools that move the process along at any given point in time. I recently redid our insurance for our company, and I went to a completely automated solution. It was really beautiful. I'm not going to give them a free advertisement here, but it was really beautiful. I mean, signing up for it, I had a broker working for me, and they said, it's going to take, at least 5 weeks to get you onto the new insurance. I went out, I signed up, and by the way, it was like a day before the month end. I went out, I signed up, they approved my insurance. They're going to send me the cards in the next week. They integrated it with QuickBooks. It was slick. That's what we expect. We expect things that can be done by us ourselves that move things along at a faster pace to be done that way. And so the broker lost my business. And it's not that I didn't go to another broker. I just went to a broker whose processes are completely automated. Anyway, Yvonne Wassenaar, the CEO of Puppet, which is a very important company. If you haven't looked at Puppet, it's an organization that we used 5 or 6 years ago. A phenomenal technology stack. As we head into this, what will likely be a recessionary environment globally. That's a recurring theme, by the way. This is not the first person to talk about this recessionary environment. There will be an increased focus on investments that deliver efficiency and optimize the business. I've heard from fellow business leaders repeatedly how they are reassessing their priorities for the year ahead, introducing new steps into procurement processes, and many of them are instituting blanket cuts. As an ex-CIO who has lived through several economic downturns, the bar for software purchases has just been significantly raised. The winning software companies enable cost containment, drive efficiency, and ensure business continuity today without turning their back on innovation. The others most likely will go out of business or be bought. So again, we're not looking specifically at healthcare. We're looking at what's happening to the enterprise software stack, and you have to consider these things as you move forward. Adam Mansfield, the practice leader for Upper Edge, envision a world where there's significant consolidation coming out of COVID-19, leaving a much smaller pool of truly viable enterprise software vendors. Through a consolidation, enterprises will be further locked into particular vendors and functionality. For example, I can see an end state where Microsoft AWS and Google Cloud are essentially left as the last survivors because Google has bought ServiceNow and Workday, Microsoft has acquired SAP and Salesforce, and AWS has acquired Oracle. I don't know about those predictions per se, but you can see that happening. There are significant financial pressures on these organizations. They're missing complete business cycles. I've talked to and heard from sales organizations that are really struggling. It's impossible to call on sales organizations, on healthcare organizations right now, or any organization that is not almost completely focused in on COVID and the impacts of COVID. So you could see, because of those downturns over the end of Q1, Q2, and maybe even into Q3, if there is a resurge in the fall, as people are talking about, that some of these companies just lose their bearing and end up getting purchased. So anyway, I'm not going to speak specifically enterprise software in healthcare. Maybe I should. Enterprise software in healthcare. We've been slow to adapt. There's a ton of ServiceNow clients within healthcare. A bunch of us are using ServiceNow. A bunch of us are using Microsoft Office 365. We call that essentially our move into the cloud. The biggest enterprise software we all run is primarily our EHR, our clinical documentation system and billing system, as well as our financials that we have to run as well. So those are the enterprise solutions. And you could see the same thing they're talking about in the broader market, we could see within healthcare. We could see a lot of companies fold into each other, so we could see consolidation. We could see a renewed emphasis on driving those companies to help us solve the problem that we have, which is to drive cost containment, drive efficiency, and ensure business continuity. Business continuity is going to be a much bigger conversation coming out of this, obviously. All right, next news story. Cerner AWS partner to make COVID-19 data available to researchers. This is not, I'm only highlighting this because it was I think it's an interesting aspect of the partnership with Cerner and AWS. They're joining to offer access to de-identified patient data to researchers fighting COVID-19. Epic's doing this as well, as are others through various things, various platforms that are out there. Let me give you a little detail. Stored on Cerner's Health Data Lab platform, which is hosted by AWS, the de-identified patient data will offer healthcare researchers a slew of COVID-19 related demographics to help track the spread and surge. This is a healthcare IT news story, by the way. The data sets are also include lab results, underlying illness and chronic conditions, and clinical complications, among other statistics. An advisory committee will choose recipients of the free offer by combining and utilizing different types of clinical, patient, social determinant, and other open source data. Researchers can build intelligent models which could, in theory, anticipate patient outcomes and help improve predictive analytics. Towards the end of last year, I talked about the fact that I believe that this partnership between Cerner and AWS has some legs to it. And of course, then everything sort of got thrown into a whirlwind with COVID-19. But I still think it has promise. I still think it will, from a data and analytics side, as well as interoperability side, I think it will level the playing field in a lot of ways. So it'll be interesting to see where this goes. Next story, and we're going to delve into the financials a little bit here. So outpatient visits down 60% because of COVID-19. Study finds, this is Becker's article, from mid-March through mid-April, outpatient visits have declined nearly 60% due to COVID-19, according to research from Cambridge, Massachusetts-based Harvard University and healthcare technology company Phreesia. The decline is largely due to the cancellation and deferment of elective procedures and preventative visits. For their analysis, researchers from Harvard and Phreesia analyzed visit volume data from that company's more than 50,000 provider clients. Researchers found the New England and Mid-Atlantic states saw the largest declines in the number of outpatient visits. As the number of inpatient visits dropped, researchers saw the number of telehealth visits increase. However, the increase only partially offset the drop of in-person visits. Okay, so I've been consulting a fair amount recently with different companies via Zoom, which has been interesting, talking to various people. And one of the things we've been talking about is we've done a phenomenal job of telling people, stay away from the hospital, it's not a safe place. Essentially, that's what we did. We said, stay away from here, go through the drive-through clinic, get your testing done there, don't come into the ER. We did a really good job. Well, we better get together with marketing and figure out how we're going to undo that job. Because our livelihoods, our revenue really depends on it. We've got to turn this thing around, and we have to make those hospitals a safe place. Last week on the show, I talked about Atrium's movement in that direction. And what Atrium did essentially was they're utilizing their digital capabilities. They're utilizing telehealth. digital hospital, bunch of marketing, to be honest with you, and their testing capabilities. And they've packaged all those things together to create safe space for people to go and continue to get care that they need. I've also been hearing some just horrific stories of people, heart attacks didn't end, strokes didn't end as a result of COVID. And we're hearing some stories of people actually having strokes at home and not going into the hospital because they're afraid of COVID. And so to a certain extent, we have some work to do here to undo what we've done in terms of cementing in people's minds to stay away from the hospital, which is now we've got to just completely undo that and get them to understand that a hospital is a safe place, and we have to make the hospital a safe place to bring people back in. USA Today went even further. Coronavirus strains cash-strapped hospitals could cause up to 100 to close within a year, and they have some, here's some quick hits on this. Network analysis of financial reports submitted to the Centers for Medicare and Medicaid Services, CMS, found that almost half of the counties with coronavirus cases are served by a hospital that reported a net loss in 2017. In communities served by 640 of these struggling medical centers, there is no other hospital in town. Nearly all of those in jeopardy are in rural counties. As the virus spreads into rural America, sometimes weeks after the urban hotspots, many small hospitals must wrestle with the choice of laying off longtime staff members. Okay, so rural healthcare is going to struggle. It's going to create a challenge, to say the least, for those rural health systems. But you know what? It's also going to create an opportunity because there's going to be a gap there that needs to be filled. And there are large health systems at some point, right? Wherever the large city is that's not too far off, should figure out a way, not necessarily to save that hospital, because I'm not sure that if it hasn't been making money for years that it is savable per se, but to provide the level of care that's required in those communities, or the best level of care that they can in those communities, is going to end up being a significant amount of work that we're going to be doing over the next couple of years, I believe. One more, and then we'll get to IT projects. So 227 hospitals furloughing workers in response to COVID-19. And they just have a list. It's a Becker's healthcare story. It's pretty sobering when you read it. Children's of Minnesota, 181 nurses. Providence, Rhode Island, doesn't have the numbers. A portion of its staff. Indiana, MU Health in Columbia, Missouri, traveling nurses. It's primarily people that aren't directly related with COVID care. But the question you have to ask is, are we going to be able to bring these people back? And it's 227 hospitals. So almost everybody is feeling a pinch that is going on. They are now looking at the financials very closely. And this is, primarily, let's see, I think it's primarily larger systems, are primarily smaller systems. You have some here. Hey, here's one. University of Virginia Health System citing revenue loss of $85 million per month due to COVID-19 pandemic. Those are the kind of numbers I'm hearing. Losses of 10, 20, 30, 50, $100 million a month-ish. And that creates a situation that is not sustainable for any length of time, and so hard decisions have to be made. Hard decisions on furloughing staff, on letting staff go. We're going to have to establish new normals. No one knows what the new revenue normal is going to be. If you came into this thing as a $1 billion health system, you might leave as a $800 million health system. It remains to be seen. There will be some revenue destruction as a result of this, and I'm not sure we're going to capture all that revenue. I've heard people talk about the fact that these cases haven't gone away. Well, some will have gone away, and it's just there just is destruction, revenue destruction as a result of this. All right, final story. Let's see. IT projects that are going to continue. Health systems around the U.S. are reporting significant revenue decline due to COVID-19 pandemic, but many also see IT projects as crucial to providing patient care. I will tell you, in my informal conversations, I'll cite this story in a minute, but in my informal conversations, the projects that people are saying are going to continue are all over the board. It really depends on how you experienced COVID-19. If you experienced COVID-19 and said we couldn't gather all the data we wanted to, there's probably a big data project after this. If you said we couldn't track PPE, there's probably a PPE project after this. There's probably dashboard projects. There's probably business continuity projects. Some are saying, look, we're doubling down on our EHR strategy. We're going to make sure that the next time this happens, that our EHR, we're on a single EHR from one end to the other. So and some are saying digital front door, digital, consumer. So it is all over the board. Here's what the story cites. UW Medicine, Seattle, University of Washington. Medicine has been an ambulatory and revenue cycle Epic customer for a long time, and we are in the middle of a project to expand our Epic footprint into inpatient and ancillary departments across our hospitals. We are not going to stop this project. Our experience with COVID-19 has further cemented our commitment to give our providers a single EHR and standardized and improved workflows. Interesting that they would say a single EHR and they say, we're Epic from one end to the other. Clearly, they're not Epic from one end to the other, or they would already have a single EHR with standardized and improved workflows. So that is the case probably in most health systems. It's not that they haven't committed to Epic. It's that they haven't finished. It's not across the board, or they've done acquisitions, or they've done M&A, and they haven't brought everything inside. Or to be honest with you, there could be 2 or 3 different variations of Epic within a health system. I like when a health system says, yeah, we're Epic from end to end. And then when you actually talk to some of the people that are running the system, they'll say, well, really, we have multiple instances of Epic. And it's a problem for them because it's different builds, different cycles, and they have to bring all that stuff together. So a lot of health systems are talking about that. Still a focus. Jesus Delgado, Vice President and CIO of Community Health System in Munster, Indiana. I'm going to read most of this because it's pretty good. We are fast-tracking our implementation of telemedicine. During the next couple of months, we are going to be onboarding hundreds of physicians. We are also enhancing our telemedicine by incorporating remote patient monitoring with full integration to our EMR. I'd love more details on that. And if Jesus Delgado would like to come on the show, I'd like to hear what you're going to do in that area. It's pretty interesting. We are realigning and reprioritizing our data analytics projects. There is already anticipation that we will have a COVID-19 back in the fall. We will have COVID-19 back in the fall. We want to have better data insight into our patient population specific to COVID-19 symptoms, which is, again, people are saying analytics is big. And we are also going to focus on IT projects that can present opportunities for cost savings or operational enhancements that can lead to better cost management. And I think that's going to be a renewed emphasis, is getting those projects. Scott Kelly, President and CEO of Asante, says, in point of fact, all of our enterprise ITS initiatives have clinical, operational, or financial consequences if they were canceled. I really wanted to highlight that comment. It's not like we went into the year and said, let's do a bunch of frivolous projects. We had projects that were tied to reimbursement, to revenue, to address physician burnout, to address clinical workflow, to drive out the costs within healthcare. So it's not like we should have a whole new set of projects because, quite frankly, unless we just completely missed the mark last year and we're planning projects that were kind of frivolous. With that being said, no one's doing that. And so to a certain extent, we're going to have to continue the projects we're doing and augment them with a set of projects that come about as a result of this. So he goes on to say that they're categorizing each of their projects into 3 categories: fixed timeline, COVID irrelevant, can be pushed out 3 to 6 months, and projects which are more discretionary. So I like the way they're thinking. They're categorizing their projects. They're sort of looking at what can we do now, and what can we delay, and what things are just in cement. Like if you're building a building and you can look outside your window and see girders up, you're going to finish that project. You're not going to leave a tower half finished, right? And so there's a bunch of fixed timeline projects. Plus there's a whole bunch of operational projects. We still have to patch and fix everything that's out there. I have pretty much run out of time. There's a bunch of really good stuff in here. At the end of the day, I'm going to say it really depends on how you experience COVID-19, what you're going to prioritize coming out of this. I will also say, I've just re-emphasize, I think there should be an exercise going on right now around a handful of things. What are those projects? And this framework's as good as any that we got from Asante. Fixed timeline, projects that can be pushed, and projects which are more discretionary. Probably that's a good high-level place to start, and then you start to move down from there and start to determine which ones have a financial impact, either reimbursement or otherwise. Which ones have the assumptions completely changed? By the way, we did this with every project every 6 months. We would start projects, they'd be multi-year projects. We get to the end of the project and realize the assumptions have completely changed because we weren't agile in how we looked at these things. I would revisit all the assumptions of just about every project you have going on within your health system and determine when this project launched, are we in the same world that we are going to exit? Do the same assumptions hold? If telehealth reimbursements go up significantly, are we in a situation where it doesn't make sense to, I don't know, launch this thing over here when we really should be standing up a significant telehealth capability and really integrating that into the larger health system processes? So I've actually gone over. So I'm just going to end right there. And there's a ton more to talk about. That's all for this week. Don't forget to send me an email, Bill at thisweekinhealthit.com. What's your biggest challenge, and what can we address in the show over the next couple of weeks that might help you? Let's see. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, ProTalent Advisors, and Sirius Healthcare for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, you can check out our website, thisweekhealth.com, or the YouTube channel. If you want to support this show, the best way to do it is share it with a peer. But the second best way to support the show is to subscribe to our YouTube channel. Go over there and subscribe. Once we get above 1,000 users, we can start doing some really fun things. And a lot of you already have. I think we've done over 300 hours of listens on the YouTube channel over the last, since we started the COVID series. So we're going to be back again every day through the end of the week as we navigate this together. Thanks for listening. That's all for now.